The Northern Territory will shut its borders in an effort to prevent a COVID-19 outbreak in remote Indigenous communities. The unprecedented measures take effect from Tuesday and is expected to be in place for 6 months. Anyone coming into the Northern Territory from interstate or overseas will be forced to self-isolate for 2 weeks.
After saying he'd do whatever it takes to protect lives, the Northern Territory Chief Minister took drastic action.
From 4 p.m. on Tuesday, the 24th of March, the Northern Territory will implement strict border controls for all access points by road, rail, air and sea.
The border lockdown put in place in a bid to stop a COVID-19 outbreak in remote Indigenous communities.
This is an unprecedented action for the Northern Territory, but these are unprecedented times.
Police roadblocks will be put in place on the 3 highways into the NT, with the Commissioner issuing a warning for those who try to get around them.
There is a fine of up to $62,800 for non-compliance with the direction of the Chief Health Officer under this public health emergency declaration.
The announcement came as 2 more cases were confirmed in Darwin. A couple had been aboard the Ruby Princess cruise ship, testing positive after flying in from Sydney.
Want to absolutely reassure the Northern Territory and particularly the community here in the top end that they have followed all the precautions and the advice.
The latest cases bring to 5 the number of people being held here at the Royal Darwin Hospital in isolation with the coronavirus. But as cases spike across the country and overseas, the government here says it's doing everything it can to stay ahead of the curve.
I've seen what's happening overseas, I've seen what's happening down south, and I'm not going to let that happen here.
Matt Cunningham, Sky News, Darwin.